everyone, I am Meiza Syafa H1A020075. I will present to you the journal with the title Sleep Disorders in Children with Attention Deficit or Hyperactivity Disorder. Check this out! Let me start by giving you some background about sleep disorders in children with attention deficit or hyperactivity disorders. Chemotherapy, induced nausea and vomiting are some background attention deficit or hyperactivity disorder or ADHD. Sleep disorders in Indonesia, children with ADHD have not been widely studied. Next, the second is objective. The goal is to understand the proportion and factors that influence sleep disorders in children with ADHD. Therefore, researchers hope that the result of their research can be useful to provide a clear explanation to parents about the factors that affect sleep disorder in children with ADHD. Thus, children with ADHD may be able to receive comprehensive management to prevent medical and social consequences. The third is methods. This cross-sectional study involved 54 children aged 3 to 14 years who had been diagnosed with ADHD by a pediatric growth and development consultant using DSM-5 criteria. The subjects were consecutively selected from March to August 2017 at the Child Development Polyclinic, Dr. Sarjito's Hospital, Yogyakarta. Sleep data were collected using the sleep disturbance scale for children SDSC and the Children's Sleep Hygiene Scale or CSHS. Next, the fourth is results of the 54 children with ADHD, 46 males and 8 females, 35 or 64.8% experience sleep disorders. The majority, 26 subjects or 48.1%, had the disorders of initiating and maintaining sleep. Children with the combined inattention and hyperactive impulsive type of ADHD experience significantly greater sleep disturbance compared to the inattention type or hyperactive impulsive type. Poor sleep hygiene was also significantly associated with more severe sleep disorders. Okay, next, turning our attention now to introduction to sleeping disorders. Sleep is a basic human necessity. Quality of sleep impacts the quality of life in children. Various psychiatric, somatic, and neurologic diseases often follow sleep disorders. Okay, a number of neurological diseases are linked with sleep disorders, including 1. Asperger's syndrome, 2. Tourette syndromes, ADHD, autism, epilepsy, and learning or motoric difficulties, attention deficit or hyperactivity disorder or ADHD, a neurobehavioral abnormality, is a chronic condition most frequently affecting school-age children. Nah, 5% the proportion of sleep disorders in children with ADHD is relatively high at 64.8%. The most common sleep disorders is initiating and maintaining sleep for 48.1%. Okay, next. So now let's move on to discussion. Sleep hygiene is the adjustment of various behaviors and environments that influence the process of initiating and maintaining sleep. Many children with ADHD tend to encounter difficulty achieving adequate sleep habits. such forming daily routines, regular sleep schedule, and regular working times. Restoring sleep hygiene steps has been proven to improve quality of sleep and effectively resolve sleep disorders in ADHD children. Sleep hygiene involves developing consistent behavior around bedtime to enhance productive and comfortable sleep. In children, factors that may improve sleep include calm sleep routines and regular sleep and walk times. Okay, next, conclusion. Number one, the conclusion is the proportion of sleep disorders in children with ADHD in relatively high at 64.8%. Number two, the most common sleep disorder is initiating and maintaining sleep, or 48.1%. And number three, children with combined type ADHD and poor sleep hygiene have a higher risk of sleep disorders. And the last one. Okay, in the last one is benefits. Researchers aim to understand proportions, sleep disturbance, and also factors that affect a sleep disorder in children with ADHD. That is the hope of researchers. Study result will be useful to provide clear explanation for parents regarding these factor effects sleep disorders in children with ADHD. Thus, the ADHD child may be able to accept comprehensive management to prevent medical and consequence. Thank you for listening. May all those we have shared be beneficial for all of us. Don't forget to like, comment, and subscribe.